Hello everybody, I am Dr. Swapnil Zambare. I am an orthopedic surgeon working at Currae Hospital. We recently had a very interesting case whereby we had a young man who had problems with his hip after COVID and treatment from COVID. What he basically had was what is known in medical terms as avascular necrosis of both his hips. This is where the hips start dying because the blood supply to the ball of the hip stops, and then the hip starts crumbling, causing pain. And that is a big problem in young individuals. This is being seen quite widely, whereby what happens is a patient gets COVID and then they get admitted to a hospital, and during treatment they are given steroids, which results in this side effect, which is quite rampant in people who are treated inpatient as COVID. This is in no way trying to say that the treatment isn't justified, but at that time the treatment is definitely somewhat justified. But what, however, is a problem is the side effects that the treatment can cause to you in the long term. So this young man was around 30 years old, slightly less than that, and he had bilateral AVN of his hips. And initially we tried to save his hips by doing core decompression and stem cell bone grafting of his hips. Unfortunately, I've tried it in a few patients, a couple of them have worked, but in him it failed. And eventually over a period of over a year, he slowly deteriorated and continued to get persistent pain and swelling. And he was having difficulty in doing his job, which was a fairly physical job, where he had a marketing kind of job where he was on field, off field, driving cars and a lot of physical things. So it was very difficult for him to do his job. So we decided to do a hip replacement. And however, because both of his hips were involved, it was decided that we'll do bilateral hip replacement. The request, however, interestingly from the patient was that he wants to do it in a single sitting. So you go into an operation theatre, get both your hip replacements done at the same sitting and finish it off. And having considered this and we read through the literature, we found a lot of support for this procedure and a lot of evidence which seemed to show that it is actually safer than doing a staged replacement. Due to which we counseled the patient accordingly, and he was quite happy to take it on board, and we were able to do a single stage bilateral hip replacement, and the patient was able to recover from it quite quickly, as I'm sure you will see in the videos here. The patient is at third or fourth day post surgery, and you can see he's walking on a walker. And here you can see the patient is at home at around 14 to 15 days and is walking independently. And here, as you can see, the wound has dried quite nicely. There is no oozing, there is no discharge, nothing at all. I'm touching the wound, no problems. And as you can see, there was some mild bleeding, which is the immediate post-op period, but that is absolutely fine now. As you can see from taking the dressings off, that this is a stitchless surgery, where what we do is a stitchless and a drainless surgery, where there are no drains kept and there is no dressing that needs to be done. And as you saw from the previous video, we just peel the dressing off and the wound settles down quite nicely, and the patient is able to walk independently, as you can see from the previous video, without any significant pain and without any major issues. Okay, he was able to recover that quickly, and we are glad that we at Currae Hospital were able to give him such a good result. So it is certainly something that should be considered in well selected patients and gives excellent results as has been seen.